days we had aerobic exercises as one of the pillars of type 2 diabetes management, for that matter any diabetes management. But for the last decade, what we've noticed is resistance training has become the game changer, and aerobic exercises, when used synergistically with resistance training, is going to drastically help with reduction in the HbA1c. We have with us Dr. Elise Brown. She's a scientist, she's a strength training expert, she's a certified strength and conditioning specialist with a vast experience in the fitness world and with a lot of publications. Welcome, Dr. Brown, and I'm really, really excited to have you with us today.
Thank you so much. I've been excited about coming on the show.
I want to put it out there that, as doctors, what we end up doing is, as prescribing physicians, we just say that, okay, go and do this exercise, like do cardio, like 150 minutes per week, or you need to do resistance training 2 to 3 times per week. But then really what the meaning of it is, we're not able to give that information to our patients. And like you said, you're working on those movement patterns, and that really is going to simplify things for a lot of people out there who don't really understand much of it, and it's going to make life much easier in terms of going forward with resistance training. And I'm really looking forward to what all is out there, like, and what are we going to explore in this podcast. Thank you. And we'll move on to the next section. So, Dr. Brown, can you elaborate what it is when we talk about resistance training? Let's just go into very basics and understand when we say let's do resistance training, and when we tell people out there, what does it really mean?
Yeah, so resistance training is just a general term for a general type of exercise that's used to increase muscular strength and muscular power. And so, muscular power, all that means is it's a combination of strength and speed. So, being able to move loads in a quick manner. And there are multiple ways that you can perform resistance training. So, it's also called strength training. If you've heard the term weightlifting or weight training, those are specific types of resistance training that involve weights. So training implements like dumbbells, barbells, kettlebells, those types of things. Resistance training can also, or weight training and resistance training can also include machine weights. So if you go into a gym and you've got machines where you do like a press, different pressing exercises or leg press, those are considered weight machines, which is also resistance training. It also includes different body weight movements that are intended to increase strength. So if we're talking about push-ups, doing air squats, sit-ups, those types of movements, that's all considered resistance training. And then what I've really been getting into the last year or so is resistance bands. So resistance bands is another form of resistance training. And one of the things I really like about them is they're affordable. People can afford a set of resistance bands for like $50 or so, and you can do a ton of different exercises at home with resistance bands. So yeah, those are all the different forms of resistance training, and just the main purpose of that type of exercise is to increase strength and power.
And there are a lot of words in terms of endurance training, circuit resistance training. Would you want to elaborate on those as well?
Yeah, so circuit resistance training or circuit training means that you are basically doing a set of one exercise. So let's say you do a bench press movement for, it's usually done for a set period of time or a set number of reps. So let's just say you do 12 reps and then you move on to, so it's basically a circuit. You move on to another exercise. So let's just say it's lunges. You do 12 reps of that, and then you move to another exercise. So you've got this full circuit, typically of about 8 different exercises. There's a specific rest period in between each exercise that you do. And so that's a really great way to increase muscle size and also decrease body fat, because you're not allowing yourself much time to rest. And especially if you include multi-joint movements, meaning that you're working multiple joints, multiple muscle groups at the same time, it's just more bang for your buck. And then you said circuit training. What was the other one that you had mentioned?
Endurance training.
Like cardio, you mean? Like aerobic endurance or?
I mean, in general, like the term endurance training is used for what purpose?
Okay, so if we're talking about endurance training, usually that has to do with aerobic fitness training, or cardio is the common term for it. So with cardio, um, you're using large muscle groups that are doing movements in a rhythmic fashion continuously. So with weight training, you do a few reps and then you rest for a little while. You don't do that with cardio. It's continuous movement. And so that would be things like going on a brisk walk, doing some swimming, going for a bike ride, those types of things. And fitness adaptations are, I mean, you can train for muscular endurance, if you may have been hinting at that. But they have different adaptations. So you would typically train for endurance or aerobic endurance if you're trying to improve the ability of the heart, the lungs, and the blood vessels to distribute oxygen to working muscles. So essentially increasing your aerobic fitness or your aerobic endurance.
Um, that's a very, very elaborate definition of endurance training that you gave, and resistance training, which is excellent. So, moving on, like, if we were to talk about in reference to type 2 diabetes management, how would you describe the benefits of resistance training in type 2 diabetes management versus endurance training or aerobic exercises? And how should we combine the two to get the maximum benefit?
Yeah, so like most of the research has found that the most effective exercise programs for type 2 diabetes, it's going to be a combination of cardio and strength training. Um, and so both of them are very, like, they share common benefits, but strength training does have some added benefits that I'll talk about in just a second. But with both of these types of exercises, both are very good at improving glucose management, so ultimately reducing A1C. They're both very good at improving insulin sensitivity, blood lipids like triglycerides and cholesterol, endothelial function, which is one of the main markers of cardiovascular disease, and also reductions in visceral fat. And so visceral fat, that's the fat that we found that surround our organs, and it's increased visceral fat is highly correlated with type 2 diabetes. So both of those exercise types are very good at improving these cardiometabolic outcomes. Now, some of the added benefits that resistance training has that cardio does not is, number one, muscle hypertrophy, meaning that it helps to increase the size of the muscles. Now, that's real. I know women a lot of times get a bit cautious when they hear increase in muscle size, but trust me, it is important for your health, especially when we're talking about type 2 diabetes, because one of the unfortunate consequences with type 2 diabetes is muscle wasting. And so resistance training is the only thing, resistance training combined with appropriate protein intake, I'll say, is going to be the most effective way to combat that muscle wasting and increase muscle size, because you have to think of muscle as being this metabolically healthy tissue that you need for better body functioning metabolically. So muscle hypertrophy is an added benefit that cardio doesn't have. Also increases in bone mineral density or bone mineral content. So resistance training helps to strengthen your bones. That's really important, especially as we start to get older and fall risks become more of a reality. So if you've got stronger bones, you're going to be less likely to fall. And if you do fall, you're less likely to, the fall is less likely to result in a fracture if you have higher bone mineral density. And then another point is, in type 2 diabetes, neuropathy is an issue, right? The longer you have diabetes, your risk for developing neuropathy increases. And once you've got neuropathy, that's what really starts to throw off your balance. And so resistance training is really good at helping to improve balance. So the two main muscle groupings that are related to somebody's ability to balance are going to be your lower body muscles and your core, your abdominal and your lower back muscles. Let's see. So other than that, um, So with also, if you're doing the exercise movements, the resistance training movements through a full range of motion, that can also help you maintain and increase flexibility. So range of motion around the muscle joints. I think that's, yeah, I think that's it.